Hi, this is Dr. Zariun. Today we'll discuss about Croup. Croup is upper respiratory tract infection, commonly affect age groups of 6 months up to 36 months. It is not common in the age groups of greater than 36 months and 6 months. The commonest season that Croup is occur on September, October, and November and December. Pathophysiology of Croup. Croup mainly affects the upper respiratory tract, the larynx and trachea, which is called laryngotracheitis. The commonest etiology can cause Croup is parainfluenza virus, which is the commonest etiology of Croup. The other etiology of Croup are respiratory syncytial virus, adenovirus, enterovirus, and human baculovirus and influenza virus are the etiology of Croup. Croup is mainly affect the upper respiratory tract below the vocal cord, which is called subglottic airway. Clinical presentation. The patient who has a Croup can have symptom of initial upper airway infection symptoms. Next to that, there is fever, hoarseness of voice, barking cough. And stridor. Symptoms wax and wane, often worse at the night, more pronounced when the child is anxious or upset. Signs: the patient can have respiratory distress, hypoxia, cyanosis, stridor at the race that indicates that severe airway obstruction. The diagnosis of Croup. The differential diagnosis of stridor can be Croup angioedema, which is caused by allergic reaction, epiglottitis, retropharyngeal abscess, foreign body aspiration, inhalational injury, airway obstruction. We do physical examination in history. In the case of history, we should consider whether the patient has onset of progression, recent oral intake, dysphagia or drooling, choking episode, Croup, underlying airway abnormality, previous intubation, respiratory conditions. In the case of physical examination, we should consider the overall assessment like vital sign, whether it is normal or abnormal, comfortability, working hard to breathe, awake or sleep, dehydration. In the pulmonary examination, we should consider the patient has abnormal sound like barking cough, stridor and barking cough. Stridor at the rest indicate that the concern for more severe disease. Investigation of Croup. We should not consider chest and neck X-ray if we are not diagnosed a Croup when in the physical examination. In the neck X-ray, we should appreciate the stipple sign, which is specific sign of Croup. The management of Croup. The management of Croup is based on Westin score, which is there is a criteria of Westin score: chest wall retraction, stridor, cyanosis, level of consciousness, air entry. Based on that, we have mild, moderate, and severe Croup. In the mild Croup, the Westin score is less than 2%. In clinically, single dose of oral steroid is enough, which is dexamethasone. At home, we can give antipyretic like acetaminophen in oral hydration, and we can do humidification, but humidification is not demonstrated efficacy. In the case of moderate and severe Croup, if Westin score is greater than 3, we can give oral steroid, IM or IV steroids. We can nebulize the racemic epinephrine. Consider inpatient hospitalization. If the treatment is failed 1 time, 3 times, 4 times, we should consider hospitalization. Evidence of epidemic respiratory failure, ICU admission with intubation may be required. Complication of Croup. Secondary bacterial infection, recurrent Croup. Most cases resolve without complications within 1 up to 3 days. Thank you. Please subscribe, comment, like and share my YouTube channel.